People who had COVID-19 are at a greater risk of developing type 2 diabetes within a year than those who managed to avoid getting COVID-19. That's according to a large review of patient records from the Department of Veteran Affairs. This morning, we're talking with Dr. Kumar to figure out what this finding means. Good morning, doctor. Thanks for joining us.
Good morning, Leslie. It's good to see you.
Good to see you as well. So tell us a little bit about the data that the researchers looked at.
Yeah, it's interesting. So they compared in the VA cohort, as you mentioned, about 180,000 people were infected with COVID that they could identify, and they compared these to historic controls of people that didn't get COVID during the same period of time, 4 million other veterans that were seen through the VA system, and then even went back to pre-pandemic era and another 4 million people, vets that they compared it to. And what they found that these people, these 181,000 vets that were seen in the VA system that were contracted COVID were about 40% more likely to get type 2 diabetes, or at least be on some kind of medications to control their blood sugar. Now, every year, diabetes is very common. 35 million, 10% of Americans have diabetes, but only about 2 million a year develop diabetes. And so the percentage of Americans is roughly, 0.5% of Americans develop diabetes every year. And in this study, about 2%. And so there's an increased risk of developing type 2 diabetes with COVID is what they've concluded in this study.
Yeah, did they have any reasoning as to why the folks who got COVID-19 were more susceptible to it?
That is the million-dollar question. It's a great question. There are theories. There's no exact answers as to why this is happening. A couple of things could be going on. In the pancreas, that's where our insulin cells are, the cells that produce insulin. And one theory is that those cells are destroyed with COVID because COVID goes everywhere. It can manifest in any organ system, that perhaps destruction of these cells that produce insulin is what's happening. But typically, people that have destruction of insulin of those cells get type 1 diabetes. You don't make any insulin, you really need it to survive. More likely is that the chronic inflammation, that disease state that just lingers, the long COVID, as we talk about, can promote insulin resistance, meaning that the peripheral cells, the cells that we use to take up insulin and sugar, glucose, that's what's impaired, typical of type 2 diabetes. So there are theories out there, more likely insulin resistance than destruction of those cells. But that's what the next phase of the study is exactly what are the mechanisms that underlie how COVID can lead to increased risk of diabetes.
Yeah, and Dr. Kumar, since the numbers are there is an increased risk. What should people really be looking for if they've had COVID? What are some of those warning signs?
Absolutely. That's the most important thing, is that if you've had COVID, even if you haven't, you ought to be having a yearly exam, check your blood sugar, and make sure that things are okay. But if you've had COVID, your antennas should be up, that perhaps you're at higher risk. Now, let's not, overblow this.
Right.
It's 2 out of 100, 18 patients out of 1,000, patient years. And so the risk is still really low. Most people with COVID will not develop diabetes. It's just that it's more common than the general population. And so symptoms of diabetes are urinating more frequently, unintended weight loss, and the people that were already at risk, obese people that had heart problems, high cholesterol, and being over age 65, you got to be aware that this could happen, and be sure to see your doctor annually, get checked, because sometimes it's asymptomatic and the only evidence is your sugar is higher. So just be aware that these things could happen. If you have symptoms of increased urination and weight loss, see your doctor. And even if you don't, once a year, see your doctor anyway.
Absolutely. See the doctor. Well, we appreciate you as always, Dr. Kumar. If you have a question for Dr. Kumar, email us at askdrkumar@gmail.com or check out his website, drkumar.com. We'll see you next time.